Yo. 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 There we go. That was probably way too loud. What's up, guys? How you doing? Hello. 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 Trying to see how much of an echo we got going on here. We got kind of a little bit of an echo. Hopefully that doesn't translate. I could eat this microphone if I wanted to. Not that I will, but like that's pretty good. That's pretty good. I could like unhinge my jaw. You know, they always call me unhinged, but sorry. Sorry, I didn't mean that. Mom, if you're watching, I apologize. Oh. All right. Anyway. All right, let's get to it. Guys, check out this. Check out this. Wait, you can't check it out. Hold up. There we go. Ta-da! In review. Those are two beautiful words. In review. We love to see it. In review. Wow. I am so happy that we finally did it. This took a little bit of time, not gonna lie. It ended up being almost 8 hours from the 5.7 projected. It became almost 8 hours. With most of it in chapter 3, but it's kind of evenly split throughout, and a lot of it's around like 30 minutes-ish. But chapter 3 takes the cake at an hour and 2 minutes. Bang, dude. So, that's pretty sick. We love to see that. What else? Housekeeping. Sales. We haven't had a singular sale since the 22nd of April. We've not had a singular sale since the 22nd of April. But hey, listen. Good things take time. Good things are, they start out small. I'll tell you what, Blackjack kind of like ground to a halt there, though. We got 1 sale from Blackjack and 5 sales from Baccarat, so. Which is kind of surprising. Like, if we go back to when it was released, let's go back to October. And then we can see, like, the release date. So I can see, like, how many total sales have happened. So since its release, we've had about 37 from Baccarat. And it has been almost 5 months. So we'll divide that by 5. So we get about $7 or 7 sales per month, which seems like we're kind of staying true to, but we're sort of slowing down. And then Blackjack, it's got 24 sales, so just a little bit less. 24 sales, and that is in 2 more months. So 5, 6, 7. Actually, no. 6, really. I think it's about 6. Almost on the dot. So that's about 4 sales per month. Let's see. Are we staying true to that? Are we staying true? Tell me, Drew. What's going on? 5 for Baccarat and 1 for Blackjack. So it looks like we kind of slowed down from the 4 a month down to 1 a month for Blackjack. And the 7 a month down to 5 a month from Baccarat. But, we sort of picked up with the generative AI. That's up to 3 sales this month. So shout out to you for buying that one. And we got 2 from the biohacking guide. And just hitting the market, we have the Red Light Therapy Revolution. Literally 2 days ago, it just hit the market. So that is on there now. Thank you guys for checking this out. This one was also kind of like hastily put together, but my future productions will not be so hastily put together. What else? We got listened to hours. I love looking at analytics like this. I really do. Despite the lack of sales, it looks like we do have some listening. So we have people listening to projects that have already been bought. So thank you so much for listening to Baccarat, the generative AI guide, the biohacking guide. Actually, the rice one. We got an hour listening to the rice one. Thank you for that. And how to play blackjack like a pro. So thank you guys. Thank you. Those were doing really well. I will not read that on stream. I'll read that later. Awesome. But yeah, so we have codes to give out for all of these, particularly the Red Light Therapy one. I got tons of codes for that. So, if you want the free copy, we got all these codes. Hold up. It's the United Kingdom, United States. Here we go. Look at this. We got all these codes. You can get them for free. We got all of these codes here. If you're watching the stream, you can get any one of these for free. Check it out. What are these? Oh, we got more. Look at that. We got more. Don't worry. Guys, we got so many codes here. What's up, Words and Words? Good to see ya. Hello. I'm just being a little audacious out here sharing some codes. What's up, man? I hope you're doing well. I was talking about the fact that I have just hit the submission button on another project. Philosophical Methods and Their Application to the Art of Living. This just yesterday. I mean, technically this morning. It was submitted. It was approved by the author. All 7 hours and 53 minutes of it. And I am so happy that this has... Nice. Your audio is done. Oh, thank you so much. Where is that? There we go. Thank you for telling me. I really appreciate that. I think what I was doing is I had it on my computer and I was editing. And now that I'm back over here in the closet recording, I turned on the Evo 8 mic and that doubled it. So thank you for letting me know. I would have done this whole stream doubled had you not told me that. So thank you so much. I really appreciate that. You are keeping me honest. Words and Words, you're a real one. But yeah, let's see. The Philosophical Methods one is done. It is done. So done. Good to go. Congrats on finishing yet another book. I really appreciate that. Thank you. Yes, it feels really good to have it completed for sure. I kind of have a better idea now of like what to expect as far as production wise goes. Because like before it was, I don't know, it was kind of up in the air, and I have a certain vision of how long it should take. And then when it doesn't take that long, and actually it takes like 3 times as long, I'm like, dude, I don't know how to even deal with this. Let me just stay up all night and do it. But now it just seems like, okay, I've pretty much a good idea. If a project is an hour, then it'll take about 2.5 to 3 hours to record it. And then those 3 hours can be like automatically trimmed down. And let's just say 3 hours. Let's say that's like 3 chapters. It'll take about another 3 hours to edit down each. Well, about an hour per. So we're talking maybe about 6 hours. What are you using AI tool you showed us the other day? I am. I absolutely am. And I don't know. I feel weird calling it an AI tool, to be honest. But Descript, I mean, it says it's AI, except like AI to me, when I did the AI book, AI to me seems like it's machine learning. So I want to say, I mean, it doesn't seem like this thing is machine learning. It seems like this is more of just automation. Kind of seems like an automation tool. I think it can use AI. I think you could do like AI speakers and stuff, but I can't do that for my projects. They put it through a test that you can't do AI on here, but like say if I open up chapter 12 here, it was pretty cool because I realized that when I put in a second, not a second speaker, but like when I put in another file, it actually, it showed up as green the other day. Maybe it stopped. Here we go. It shows up as green on here. I thought that was super cool. Like this is the I was going through and I actually skipped a whole section, so I'm really glad that I read this at 3x speed and allowed myself to check, because I skipped like an entire section. I couldn't believe it did it. So, always good to keep that in mind. And so I was like, dude, if you find anything that's wrong with it, please let me know. I will fix it forever. If it is automation, then no so much AI, but it must be involved in some way. Maybe. I hope that there's some amount of machine learning that happens on the back end that I'm unaware of. Because as of right now, like if I go on to this tool and I go on to Underlord, which is their AI thing, right? Like if I highlight over it, let's see, what would you like to do? Shorten. So I guess you could ask it to do something. You could ask it to find something. So like in a way, I think that this is kind of AI, but the way I use it is more just like automation. Say if I took out the word gaps, is it AI? To me, I feel like AI is like taking this result and putting it back in and saying, how do I improve that? Did I get better or worse? And like ranking it on a scoring mechanism. But this seems like, hey, just track for long pauses, and in those long pauses, make them smaller. But it can do a bunch of stuff. It can do create active speaker, green screen, automatic multicam. I can't wait to use this on a podcast. This thing would do so well on a podcast. Yeah, this thing would do so well on a podcast. But I wanted to come on and I wanted to take it easy, but I wanted to do something to sort of move the needle on things. And we've been sort of chipping away at it, but right now, well, it does the job and that's what counts, yes, and it makes it so much better. Like, it does make it so that I still have to go through and like listen in and then adjust the clips as I would have done anyway, but like it makes getting to that point way quicker, and being able to like do the dirty work that I know needs to be done, but like I don't enjoy taking out retakes. That is really arduous on my mental headspace. But like being able to just have this tool to go in and automatically take out all the retakes and then leave you with the best takes to edit, that makes it, I want to say it improves the turnaround time by a factor of like 2.5. It's so much better. So much better. So I'm really happy to report that it's been very nice for the time being. And I have heard of something else. I think it was called hermeneutics. No. Hindenburg. Daw. Yeah, Hindenburg is apparently very similar, but it looks older. Hindenburg, why it's the best podcast editor. Hindenburg versus Reaper and others. Podcast pieces, conventional podcasting. Everybody's saying Reaper. Even if it's designed for video, DaVinci Resolve has a pretty amazing DAW built in. See, I don't trust the free ones though. Okay. Yeah, I might try it. It seems actually cheaper to go with Hindenburg. I might give it a go at some point, but as of right now, I'm not really worried about it. Not really worried about it. Yeah, is the TikTok or YouTube chat not showing? So TikTok unfortunately cannot be shown on screen. TikTok is, I can't really access the TikTok chat to be able to plug it into this Prism Live Studio. I think there's a way with like OBS, but since I use Prism, it has limited functionality, but it's more user friendly. So I might get more into OBS streaming at some point, but for right now, I am unfortunately unable to show TikTok chat, but we are not broadcasting on TikTok just yet. I definitely will, though, here in a sec. Yeah, the last time I went on, I broadcast for an hour and 3 minutes. Ooh. Nice. That's cool. Thank you. How are you doing, Words and Words? I feel like I haven't spoken to you in a minute. Hope you're doing well. I've been so focused on this audiobook. We got some followers 2 days ago. Okay. All is well. Thank you for asking. Awesome. I love to hear that. Oof. All right, let's see what I said. Dang. That's so goofy. I'm going to put we done, but all in lowercase. Yeah, I got paid by TikTok earlier today though, and it was like $25, and I was like, "Thank you, Kirsten." Thank you, Kirsten. I appreciate that. Okay. All right. Let's see. I'm going to put book recording. And then I'm going to change the board to be story. Let's see. I'm going to put it story. I think I'm going to do medical, law, and technological advances. There we go. Done. Could not be completed. Could not be completed. Go live. Go live. All right, we going live. We going live. Hey, my boards aren't up. What happened to my boards? Interact. Enhance. Boards. Use. Add. Bam. Bam. What's up, Faith Marie? Hello, Faith Marie. What up, Nina? El Nino. Coming at you, Lino. Bigger, better than whatever you seen, yo. Whatever you seen, though. Yo. Green, lean machine, lima bean, shrunk down to the size. Feeling like a fiend. I'll let you focus and leave the tab on. Yo, you were awesome. I appreciate you so much. Words and words. We're almost to average 3 people. We're almost. I appreciate that. Thank you for saying that. You are amazing. I'll be back on, Eric. I'll be back on later. Happy recording, editing, and streaming. You the best. You are the best. Thank you. Morgan Gardner. Morgan. Hello, Morgan. How are you today? I don't know why I'm saying your name so weird. Hello, Morgan. How are you? Skippity beep boo. It's just you and me, Morgan. It's just you and me, Tim. It's just you and me. Buddy. Hello, Sarah. How are you today, Sarah? Okay. Put that on my desktop. Whoa. Put it on my desktop. Oh. It already exists on the desktop? Really? Let's find out. Yeah, it sure does. Would you look at that? Twice. That would have been the third time it was on there. Okay. In fact, I don't even need it on this computer. What am I doing? I'll need it on this other tablet. Nine notifications on Twitch. I feel so popular. Okay. Okay, I don't think it's any of these, so I should probably airdrop it. To me. There we go. Where were we? All right. Well, hey, if you're new in the stream, say what's up. How are you? How you doing? What are you up to? All right. We're making an audiobook. Today. What up, Mama Malls? Get up. Big ups. Good to see you. All right. I'm going to do D&D. Then I'm calling me. Where am I at? No camera. Mute. Join. Join. No camera. Mute. Share screen. Screen is shared. Script. There we go. All right. That's the book we're reading. I gotta move my guy. Video capture device. Move that over a bit. Hello. Good to see you. Okay. Now, is this kind of where I'm gonna be? Oh, that's what I want. This is kind of where I'm gonna be. I'm gonna move everything over so I can move this. Hello. Thank you so much, Phoebe. I appreciate that, Phoebe. Thank you. You are so sweet. I appreciate all the likes. Let's see. I move this. I promise I'll be on my other account here soon. I missed you. I missed you more. I will be on my other account here soon. But right now, I'm just taking it easy because we just finished this book, and I'm like, whew, I had to stay up so many nights to get this totally finished. But we got it finished. We got it in. And it feels good, honestly. Okay, bye. I'm leaving. I have to finish an essay. Hey, me too, honestly. But I love you, and I love you more. Thank you so much. I appreciate you, Phoebe. I hope you have a good time. If you need someone to proofread your essay, you just let me know. I got you. It may flag it for being AI, but hey, I'm here. And as long as it doesn't flag me, I got you. All right, where are we at? Because it says that we're at the end of chapter 3. But this is looking pretty short, to be honest. Okay, never mind. That's 45 minutes. Implement continuous monitoring of systems and activities. Implement continuous monitoring of systems and activities to detect. Good job on finishing the book. I'll see you soon. Thank you so much. I worked so hard on it, so I'm feeling it right now. I will see you soon. You are amazing. Trying to not make my laptop fall. Implement continuous monitoring of systems and activities. Implement continuous monitoring of systems and activities to detect and respond to suspicious activity in real time. Oof. What is the deal with those settings, bro? I'm going to have to paste the channel strip settings. I'm going to have to put them onto something. Challenges and good practices in protecting health data. Okay, so I'm going to go into the compressor. Thank you so much for the heart meme, Mary. You are amazing. I appreciate you. Thank you. I'm gonna turn the compressor up about 2 decibels, and then I'm gonna save this channel strip setting, copy channel strip setting, and then I will paste that also. Paste chapter 1, paste, because I don't know what I had before, but it wasn't good. And then I'm going to paste it onto the introduction, and then open and closing credits. Some comments in the live were filtered, guys. What are we doing? What are we doing, guys? What are we doing? All right, so if I did internal monitoring. Okay, that sounds good. I like that. Cool. But does it come through on here? I think it's duplicating it. So what I'm going to do, much to my chagrin, is I'm going to turn off Evo 8, and hopefully the sound quality sounds good. Hopefully I remember it when I switch tabs. Thank you so much, Mary. I appreciate that. Okay, so the plan is I'm going to record for maybe about an hour-ish, and we'll see how far I get with chapter 2. Hopefully I just do, or chapter 4. Hopefully I just do chapter 4. You know what I mean? We'll keep it light. Just do a chapter. Who knows? Maybe we'll do it for 45 minutes. I don't know. Chapter 4. Legal and ethical aspects of clinical research in different countries.
in different countries. Chapter 4: Legal and ethical aspects of clinical research in different countries. In different countries. Concept and Concept and importance of clinical research. Clinical research is an essential component of medical science, playing a key role in the development of new treatments, medications, and diagnostic methods. It is defined as a set of systematic studies conducted on human beings. It is defined as a set of systematic studies conducted on human beings with the aim of evaluating the efficacy. Hi, Vivel. Good to see you, Vivel. Hi. It is defined as a set of systematic studies conducted on human beings with the aim of evaluating the efficacy, safety, and adverse effects of medical interventions. These interventions may include medications. Need more push. You okay? Ooh, 1 second. All right, we good. We good.
Okay, check 1, 2.
These interventions may include medications, may include, hit the mic there. These interventions may include medications, medical devices, surgical procedures, and behavioral therapies. The importance of clinical research. The importance of clinical research. No, probably like. The importance of clinical research lies in its ability to generate robust scientific evidence that supports data-driven medical practice. By conducting rigorous studies, clinical research provides the information needed to determine whether a new treatment is safe and effective. This, in turn, allows healthcare professionals to provide more informed and accurate care, basing their decisions on scientifically proven results. Evidence-based medical practice significantly improves the quality of healthcare by reducing the risk of ineffective or harmful interventions and promoting more effective and personalized medicine. Yeah. Furthermore, clinical research is crucial to ensure that new patients are safe and effective before they are made available to the public. This process involves several phases. Starting with initial safety studies in a small number of participants, followed by broader trials to evaluate effectiveness in larger populations. Only after the successful completion of these studies and demonstration that the benefits outweigh the risks, can a new treatment be approved by regulatory bodies and introduced to the market. Clinical research also plays a vital role in discovering and developing new therapies for diseases that currently lack effective treatment. Thank you so much, Marilla. I appreciate you. Mario, I appreciate you. Clinical research also plays a vital role in discovering and developing new therapies for diseases that currently lack effective treatment options. Effective treatment options. Without clinical research, significant medical advances, such as the development of vaccines, medications to treat chronic diseases, and new surgical approaches would not be possible. Thus, this area of medical science is fundamental not only to the progress of medicine, but also to the continuous improvement of global public health. Okay, all right. Thank you so much. I really love your English accent. Thank you so much, Mario. I appreciate you saying that. Thank you so much for the likes as well. Hopefully I'm getting better at it. I feel like every time I come on here, I forget how to speak English. So, it's really nice to be confronted with the limitations of your performance and be able to say, I don't know why I can't say that, but I can't say that right now. How do I find a way around it? Or that didn't sound the way I thought it would sound in my mind. How do I say it differently to get it there? So I feel like this is a really rewarding experience for that specifically. Ooh, all right. Chapter 4, though. Looks like we're kind of working our way through. Okay, I needed that. My son Caesar and Natalia send you their regards. I love that. Well, you tell your son Caesar and Natalia that I appreciate them as well, and they have a wonderful mother. All right, let's see. Where was I? You're so amazing, though. I really appreciate your support, and thank you so much for all of the likes. I really appreciate it as well. It definitely helps push it out to more people as well, so thank you for that. Conducting clinical research. Conducting clinical research must follow strict ethical and regulatory standards to protect the rights and well-being of participants. This includes obtaining informed consent. Where participants are fully informed about the risks and benefits of the study before agreeing to participate. Needs more drive. Before agreeing to participate. Furthermore, studies must be conducted according to rigorous scientific protocols. Studies must be conducted according to rigorous scientific protocols and closely monitored by ethics committees and regulatory authorities to ensure data to ensure that the data generated is reliable and that participants are treated with dignity and respect. Therefore, clinical research not only enables significant advances in medicine, that's too choppy. Clinical research not only enables significant advances in medicine, but also ensures that these advances are implemented safely and effectively. This is going to be a little challenging. Hold up. It is an indispensable tool. It is an indispensable tool for the continuous improvement of healthcare, allowing medical practice to evolve based on solid scientific discoveries and ultimately contributing to the well-being of society as a whole. There we go. Regulation of clinical research in different jurisdictions. The regulation of clinical research very significantly depending on different between the regulation of clinical research varies very significantly between different countries, reflecting the different ethical, legal, and cultural approaches adopted globally. These regulations are primarily intended to protect research participants, ensure the integrity of the data collected, and ensure that studies are conducted in an ethical and scientific manner. The diversity of these regulations also reflects each jurisdiction's priorities, and concerns regarding the protection of human rights and the promotion of public health. In the United States, clinical research is strictly regulated by the Food and Drug Administration, FDA. This agency establishes detailed guidelines. This agency establishes detailed guidelines for the approval of new drugs and medical devices, which include requirements for obtaining informed consent from participants. The FDA also requires that all studies be reviewed by institutional review boards, IRBs, which are responsible for ensuring that studies meet ethical and safety standards. Additionally, researchers must follow good Clinical Practices, GCP, a set of international standards that guide the conduct of clinical trials in a way that protects participants and ensures data quality. In the European Union, clinical research is overseen by the European Medicines Agency, EMA. The EU Clinical Trials Regulation EU number 536/2014 harmonizes the rules for conducting clinical trials across the European Union. This regulation aims to promote the protection of participants, guarantee the quality and reliability of data. I can't access that down there. What's going on? Thank you so much for the shares. I appreciate that. This regulation aims to promote the protection of participants, guarantee the quality and reliability of data, and facilitate the conduct of transnational clinical trials. Before starting a clinical trial in the EU, it is necessary to obtain approval from an ethics committee and authorization. Thank you so much, Mario. Thank you. And authorization from the competent authorities of the country where the study will be carried out. This rigorous process ensures that trials are conducted in accordance with the highest ethical and scientific standards. In Brazil, clinical research is regulated by the National Health Surveillance Agency, ANVISA, and the National Health Council, CNS. Resolution CNS 466/12 establishes guideline. Oh, it's an art. All right. Establishes guidelines and standards for research involving human beings. Requiring ethical approval of studies. By research ethics committees, CEPs, before they begin. This resolution also emphasizes the importance of informed consent, ensuring that participants are fully informed are fully informed about the objectives, risks, and benefits of research before agreeing to participate. Before agreeing to participate. I can't reach like back here. Thank you so much for the roses. I appreciate you. Thank you, Mary. I appreciate you. Before agreeing, agreeing. Before agreeing to participate. Furthermore, Anvisa oversees the safety and effectiveness of new medicines and medical devices tested in clinical trials in Brazil. Ensuring that the studies meet established quality standards. These different regulatory approaches, while distinct in their specifics, share a common goal. Protecting the rights and well-being of research participants and ensuring that medical science advances in an ethical and responsible manner. Harmonization and international cooperation between regulatory agencies also play a crucial role, especially in a globalized context where many clinical trials are carried out in multiple countries. Collaboration between these entities helps ensure that clinical trials are carried out with the same ethical and scientific rigor around the world. Contributing to global confidence in the results of clinical research and the safety of new treatments developed. I feel like I'm clearing my throat every 10 seconds. A lot of the issues that I experience are like, oh, I didn't have enough air there, or like sometimes when I reach the end of a word or a phrase, I will start to like lose it and I'll kind of hear it. So I have to be mindful of like pushing the last bit of air a little bit harder than I would any other thing. By the way, happy Labor Day in advance. Thank you so much. Happy Labor Day to you as well. I appreciate that, Mario. Thank you. Hopefully you're doing some fun things on Labor Day. Hopefully you're doing some fun things indeed. I have to really focus on performance when I'm doing this, though. Where it's like, okay, take a big breath beforehand, let out a little bit, and then go. Because I find if I have too much breath, it always turns out to be a bad take. So I got to let out just a little bit. And then find that middle ground approach with my throat clear, because that's often usually an issue where the throat has a little bit something going on that I got to clear it. But if I can find that happy medium between everything and develop a good flow, then I can get a good take out of it. So I'm trying to find my way to the best take. Thank you so much. Oh my gosh, 5,000 likes. Maria, thank you so much for 5,000 likes. You are amazing for all of those wonderful likes. Thank you so much for all those double taps. I appreciate that. Mario, thank you. That helps out a lot. So thank you for that. I appreciate you. I tend to see that the more likes something has, the more it'll get impression wise. So thank you for that. Thank you for that. Yeah. Thank you. Big breath. Okay. International standards and guidelines Declaration of Helsinki, SIOMS, etc. International standards and guidelines play a crucial role in harmonizing the ethical and scientific standards of clinical research around the world. Some of the key guidelines include Declaration of Helsinki. The Declaration of Helsinki, developed by the World Medical Association, WMA, is one of the most important and influential documents in the field of ethics in medical research involving human subjects. First established in 1964 and revised several times since then. The statement provides a set of ethical principles intended to guide clinicians and researchers in conducting clinical studies. The main emphasis of the Declaration of Helsinki is the protection of the rights, safety, and well-being of research participants. Recognizing that medical progress depends on research conducted on human subjects. The Declaration insists that such studies must be carried out in a manner that respects the dignity of individuals, protects their integrity, and minimizes risks. One of the key pillars of this document is the principle of respect for the autonomy of participants, which translates into the requirement for informed consent. Individuals must be fully informed about the aims, methods, risks, benefits, and alternatives to research before deciding to participate. This consent must be obtained freely, without coercion or undue influence, and can be withdrawn at any time without prejudice to the participant. In addition to informed consent, the Declaration of Helsinki emphasizes the need for all medical research involving human subjects to undergo independent ethical review before beginning. This review must be conducted by a research ethics committee, which is responsible for evaluating the scientific validity of the study, as well as its ethical aspects, ensuring that the risks to participants are minimized and that the potential benefits justify these risks. The ethics committee also monitors the conduct of the study, ensuring that participants' rights are respected throughout the research. The Declaration of Helsinki also addresses the issue of balancing research interests and the rights of participants. It clearly states that the well-being of participants must always prevail over the interests of science and society. This implies that in situations where the risks to participants outweigh the potential benefits, the study should not be carried out. Furthermore, the statement highlights the importance that research results, whether positive or negative, are published and shared in a transparent manner. Thus contributing to the global body of scientific knowledge. This document also states that research must be conducted by scientifically qualified individuals and under the supervision of a person competent in medical care. This ensures that research is conducted in accordance with the highest standards of clinical practice and ethics, providing additional protection for participants. In summary, the Declaration of Helsinki establishes a robust ethical framework for medical research involving human subjects. By insisting on protecting the rights, safety, and well-being of participants, and by requiring independent and rigorous ethical reviews, the Declaration ensures that medical research is conducted in an ethical and responsible manner. This document continues to be a fundamental reference. For clinical research ethics around the world. Guiding researchers, ethics committees, and institutions in conducting studies that respect and protect the individuals involved. All right, I am on the SIOMS guideline. Let's scroll down. Let's see how much longer. So we got SIOMS, we got good clinical practice. We have rights of research participants. We have case 1, case 2, case 3, Then we have the end of chapter 5. Around 133. So page 133, and what? We are on page... Where did chapter 4 begin? Couldn't have been that far up. So we had 108. So we made it from 108 to... $115. So we got, I'm just doing a little math. 108 minus 115 is going to be 7 pages. And then chapter 5, I think I saw, was on 133. So 133 minus 115 is 18 divided by 7. That is do what we just did, but 2.5 more times. 2.5, so 2.5 multiplied by 32 minutes is just over an hour. Okay. All right. That, well, just over an hour. It's like an hour 20. 1.5 hour. Okay. All right. Calm down, rest, start again. Absolutely. No, we're always doing that here. It's just... But I think I can make it to the end of chapter 4. I think that I can. I think I'm about like a third of the way through, though. I think. Let's see, 108 minus... What is this? 132 is going to be 24 pages. So 24... 7 out of 24 should be easy math, right? Yeah, it's just under a third. Okay, so take what I did and then multiply it by 3. All right. Yeah, I could do that. Yo, Kirsten, what's up? Whoa, thank you so much for the night star, Kirsten. And the good night. Thank you so much for popping in for the good night. I hope you're having a good night. Thank you so much for that. I appreciate you, Kirsten. Thank you. I know I recently TikTok pays out on Wednesdays, and I saw the TikTok this time was like, you got $25 from TikTok. I was like, usually it's not that much. So I was like, yo, Kirsten was like going hard in the paint. You could tell, literally. So that's, wow. Thank you. I appreciate you. Thank you. That is, you are far too kind. But I'll tell you what, Kirsten, we have good news because we released that book that we'd been working on for a while. That was released and ready to go. So now we'll see when it's on the market. But yeah. I think that's my longest book so far. It turned out to be just shy of 8 hours. I think it was planned to be 5.7 hours. It turned out to be 8 hours. So, yeah, about that. That's okay, though, because... Oh my gosh. I think I scrolled too far. Oh, here we go. Yeah, because 108, we were on 108. And I think we made it to page 112. No, we made it past that. 115. Yeah, here we go. We were on Siam's guideline. It's finally done. It was, and I had to just dial in and just do the thing. Like, oh my gosh, it took forever though. Like, in theory, it doesn't take that long, but I think every single chapter I worked on took about like an hour, maybe an hour and a half, right? Which is just like you multiply that by 14. we did the rest of the recording, and then we did 14 chapters edited down. So that itself was like 14 hours ish. I was feeling like I was working a second job. It was a lot. It was quite a lot. But now we are done, so I'm very excited to report that it is in quality checks anyway. The Red Light Therapy book has just hit the market. So we're on Audible for Red Light Therapy. What else? Now I'm just working on this medical law and technological advances book. Definitely a second job. Yeah, at the very least part-time, but feels like more than that, to be honest. So, I'm just focusing on just doing a couple background things at the moment while I wind down from that project. And this also is getting me like geared up to do my next thing, which is going to be the legal foundations of a free society. I admire you a lot. Thank you so much, Mario. Thank you so much, Mario. I appreciate you tremendously. Thank you so much for the heart me, Ryan. I appreciate that. Ryan, you were the goat. I appreciate you. But yeah, we finally have those. So I'm thinking that I have enough on Audible that I might be able to create some sort of list and then link that list on places to be like, hey, if you want to support me, check that out. But at the same time, like, I will give you a free copy. If you really want one of these books and you cannot afford it, please let me know. I will give you a free copy of it, a free download. And then also just like hit people up with some free downloads as well. I think that'll be super cool. And then maybe I'll make like a Facebook page as well. I don't really like Facebook, to be honest, but I think it might be good for this thing. So I'm gonna do my best with that. Why is this not sharing? Huh. Thank you so much. I appreciate that. There we go. That's what it should look like. Script, properties. There we go. That's what it should look like. Okay. Eric's my favorite Eric Pullman. Yo, Ryan, I would say you're my favorite, but my brother's name is Ryan, and I can't be playing favorites like that. But I appreciate you. Thank you so much. Thank you. Go get the microwave. Yes, you could. It's totally allowed. I don't know. My brother might feel very hurt about that. My brother might feel very hurt. He'd be like, "Yo, what the heck? I'm your A1 since day one, dude. What's the deal, man? I knew you since no one knew you." I am Ryan. He's just one Ryan. That's true. Double the Ryan. So you do got that going for you. Let's see. Yo, we don't have Puerto Rican Ashley in the chat. What's up, Puerto Rican Ashley? Where you at? Where you at, Puerto Rican Ashley? I don't see you on the kick stream. Come on, girl. What you doing? All right, let's see. What else? Oh, I should make some kick. Clips. That'd be funny. Just to show them that I actually do check the kick chat. And like leave it on there for them to check out when I'm gone. I think they'd like that. Thank you so much for the share. I appreciate the share. All right, let's see if I can talk my way in back into this. SIOMS SIOMS guidelines. The SIOMS guidelines, developed by the International Council of Organizations for Medical Sciences, SIOMS, are a comprehensive set of international ethical guidelines intended for biomedical research involving human subjects. These guidelines were created to complement and expand on the principles established by the Declaration of Helsinki, offering more detailed guidance for ethical conduct of research. For the ethical conduct of research, especially in complex and challenging contexts. One of the central areas addressed by the SIOMS guidelines is obtaining informed consent. The guidelines emphasize that informed consent is an ongoing process of communication between the researcher and the research participant, ensuring that individuals are fully aware of the objectives, methods, risks, benefits, and alternatives to research. Consent must be obtained voluntarily without any form of coercion or pressure, and must be documented appropriately. The guidelines also recognize that in some contexts, such as research, right? Thank you. Yes, we stand that. I consent. Benefits. Consent must be obtained voluntarily without any form of coercion or pressure, and must be documented appropriately. The guidelines also recognize that in some contexts, such as research involving populations with low literacy, verbal consent may be acceptable as long as it is properly recorded and accompanied by clear and understandable explanations. I don't know why I can't hit like certain spots in my throat. Explanations. Maybe it's because I'm like crowded up over here and I'm like sitting down, and like maybe if I sit up a little bit, it's easier to access my entire diaphragm. I'll try to sit up to make it. Oh, what's up? How you doing, YouTube? Good to have you on YouTube. What's up? What's up? Another important focus of the SIOMS guidelines. Lazy tongue going on. Blah. Another important focus of the SIOMS guidelines is the protection of vulnerable populations. SIOMS recognizes that certain groups of people such as children, the elderly, people with cognitive disabilities, and socioeconomically disadvantaged communities may be in a position of greater vulnerability during research. The guidelines emphasize that when conducting research involving these populations, researchers must take additional steps to protect their rights and well-being. This includes the need to obtain consent from legal guardians where applicable, and ensure that participation in research does not represent a risk disproportionate to the expected benefits. The guidelines also address equity in the selection of research participants. SIOMS emphasizes that the choice of participants should be based on scientific and ethical principles, and not on criteria such as vulnerability, convenience, or potential for exploitation. Thank you so much for popping in. I really appreciate that. I'm going to sleep. I hope you helped with the likes. You did. You helped me tremendously with the likes, up to 11.2 thousand. Mario, I hope you have a wonderful night's sleep, and I hope you get plenty of rest. Thank you for tapping like crazy on there. I really appreciate you. Mario, you are awesome. You are amazing. I love you, and I hope you have a wonderful night. Thank you. Thank you so much. I appreciate that, Mario. I appreciate that. Let's see. Since 16 comments, let's go. 10.7 thousand. Thank you so much for all of those likes. I super appreciate you. You were amazing. You're wonderful. Thank you so much for the shares. Every single thing. You are the best. You are the best. That is you. I appreciate you. Thank you. Okay, let's see. The guidelines encourage researchers to ensure that the benefits of research are distributed fairly, and that the populations that contributed to the research can also benefit from it. Can also benefit from its results. Yeah, I think it's pretty good. What's up, Artie? Good to see you, Artie. Hello, welcome in. Hello. Good to have you. Welcome in. How are you tonight? How are you tonight? Thank you so much for all the love in chat. You guys are great tonight. I appreciate you. Regarding risk assessment. Regarding risk assessment and management, the SIOMS guideline. The SIOMS guidelines guide researchers to carry out a rigorous analysis of risks and benefits before starting a study. This analysis should be reviewed periodically throughout the research, and any additional risks identified should be immediately communicated to participants. The guidelines also suggest implementing measures to minimize risks, such as including ongoing monitoring and creating emergency response plans in case problems arise during the study. Furthermore, the SIOMS guidelines emphasize the importance of independent ethical review for all biomedical research studies. This review must be carried out by research ethics committees, which are responsible for evaluating the study's compliance with established ethical principles, ensuring that the rights and well-being of participants are a priority. Big breath. How about you? I'm doing really well. Been a little rough. I'm so sorry to hear that. Artie, I'm so sorry to hear that. But I'm doing okay today. Glad to hear that you're doing better. So sorry to hear that you were doing rough. Glad that you made it through. Hopefully whatever was getting you down or keeping you back is getting better in your life. So very sorry to hear that, but glad to hear it's on the upswing of things. Hopefully you are doing okay. I'm doing fantastic. I just released an audiobook yesterday, really earlier today. We put the submit button on there, so we finally were able to press the submit. It's in review, and I just had the red light therapy one hit the markets on the 28th, so 2 days ago. Very excited to see that. Thank you so much. Absolutely. Thank you. I appreciate you. So, very excited to see that one. We're working our way. We're sort of chipping away on this book. The Medical Law and Technological Advances. I've been doing this since this was one of the first projects I was accepted for, and I've been slowly chipping away at it. It's been kind of long, and the other ones have been a little more pressing, but this one needs to be done as well. So I want to slowly chip away at this while I'm also chipping away at the legal foundations of a free society. I don't think that we're going to get through the nuclear energy series. The ones I try to release have encountered a problem or something with the system, so I don't know what's happening with that one, but it's nothing good from what I can see. But we'll make some traction on this one because it's been due for a little while, and I want to make sure that these guys get something at the very least. This is so related to my future field. No way. That's so cool. Wait, are you doing the medical field? Are you going into that then? Because I sort of work. What's up, Cammy? Good to see you, Cammy. Welcome in, making a cameo. Good to see you. Yo. Yeah, so that's really cool. I love to hear that. Informed consent is really big. Medical ethics was one of the classes that really changed my perspective on things. We talked about the foundations of ethics, and then we had to go into like philosophy itself. It's very, very philosophically based. So, you know, when I look at like Immanuel Kant, for example, like I totally know about the categorical imperatives of things and like the basics of ethics, and then how then that applies to. Thank you so much for the bracelets, Ryan. Ryan, thank you for the bracelets. I appreciate you. Informed consent is a huge topic of discussion, though. So I am not surprised to see it in this book, and love to talk about it more because it is what it is. Consent is like one of the most important things, and I think that informed consent, that concept, has been one of the game changers in life, something that really changed my perspective on things, because it's really important when somebody says informed consent is obtained without coercion. Fully explained with all of the facts. Like, I'm a big person to say that I am a man of my word, right? Like, if I say that I'm gonna do something, I want to go out of my way to do that thing, whatever it is, whatever it might be. And it might like severely damage me to do it, but like, I want to make sure that if I say I'm going to do something, that I follow through with that commitment. Because then what that does is like, of course it makes me look good, because obviously like I'm somebody who does what I say I'm going to do, and that people can trust me. So obviously that's a given. But like, what I think that it really does that's more important than that is it trains in your brain to only say things that you absolutely mean, like with 100% sincerity. And if you don't mean it, then you won't say it. Unless it's a joke, and then it's obviously a joke, and you don't mean what you say. But it's not really what I'm talking about here. What I'm saying is, like, if I say I'm gonna show up on Saturday, I don't care if I'm late, I'm gonna make it to that thing. So informed consent is really important, because when somebody says, hey, can you do this? And you say, yeah, I can absolutely do that for you. And then they're like, okay, cool. And they hit you with a fat stack of like papers, and they're like, here it is. And you're like, whoa, I didn't know this is what it was. This is so much more work than I had bargained for. And they're like, well, you said yes. That's not informed consent. That might have been consent, but it wasn't informed consent. Ryan, thank you so much for the 4 roses. You are amazing for the 4 roses. I appreciate you. But informed consent is it's a very important topic to me because of that very fact. A lot of people try to coerce you to do something. They'll try to make something look prettier so you'll say yes, and then try to get you to follow through with your commitment when it's apparent that it's way more than what you bargained for. So I like that a lot, and that topic really changed my perspectives on things. And I really thought, okay, well, I don't really like that, and I don't know why, but now I have words to put to it. Now I have a philosophical perspective to derive it from, to say like, well, it's very unethical the way you approach that. I signed a false bill of goods. I really thought that, things were in this way that you've described. However, they are very drastically different. And I said yes to this other thing, but now you've peeled away the veil, and I see the reality of the situation. And it is far deeper and far more arduous of a path than I could have ever said yes to. So I'll do my best, but I don't think that I can. And that's okay to say. And that's really complicated to think. And sometimes you need to have the language of philosophy or ethics or even medical ethics, like that. Even that specific application of it really gave me the language to break down what that concept was and figure out, why is that so uncomfortable for me to think about? Why is that such an odd idea? Thank you so much for the heart puffs. Ryan, you were amazing for the goat. And the lightning, you are amazing. Thank you, Ryan. You are amazing. All right, let's see. Let's get some more recording done. Good clinical practices. Good clinical practice. GCP. Good clinical practice constitutes Good clinical practice constitutes an essential international standard for conducting clinical trials, focused on protecting participants and ensuring the integrity and quality of the data collected. This set of guidelines is widely recognized and adopted globally, being a fundamental pillar in clinical research around the world. The GCP guidelines are applicable to all phases of clinical trials, from early in-human studies to late phase studies, and cover all aspects of conducting a trial, including design, conduct, monitoring, auditing, documentation, analysis, and reporting of data. Adherence to GCP ensures that clinical trials are carried out in accordance with ethical principles, and that the rights, safety, and well-being of participants always come first. One of the fundamental principles of good clinical practice is the protection of study participants. The GCP requires that participants are adequately informed about the potential risks and benefits of the study, which translates into obtaining robust and detailed informed consent prior to their participation. This consent must be obtained voluntarily without any type of coercion. And participants must be free to withdraw their consent at any time without suffering any harm. Furthermore, the GCP stipulates that all clinical trials must be reviewed and approved by a research ethics committee, ensuring that studies are conducted in accordance with established ethical and scientific standards. GCP is also strict about the integrity of data generated during clinical trials. Bro, what are you doing? My brother came into my YouTube channel. He said, time to hop on Marvel Rivals? Bro, what are you talking about? Bro? Time to hop on Marvel Rivals, says Chris Pullman. What are you talking about? We've got Schedule 1 to play. What are you talking about, dude? Marvel Rivals. My coworker was actually talking about that earlier today. Yo, what? You share this? We got 3 people in the chat. What's up, YouTube? Good to see you, YouTube. Popping in here. It's popping. Good to have you. I am reading an audiobook, so if you're reading this, it's too late. Let's see. Viewing Eric's screen. Okay. Why is this not updating? Hi, Chris. Welcome in. Yo, Kirsten, thank you so much for that. I'm in your Twitch too. Yo, dude, he is flipping back and forth. Good to see ya. Good to have you, mein Bruder. Welcome in. Thank you so much for propping up my views on both channels. My Twitch definitely needs it. I'm going for affiliate. I'm going for affiliate official. He's everywhere, but here he is. He is. I don't think he does TikTok, to be honest. I haven't really seen him much on the TikTok. Wait, he's in Kick too. I'm joking. I'm joking. He's not in Kick, but he could be. Huh. I'm gonna reshare this. I don't know why it's not working correctly. Script, properties, live on Kick. What's up? What's up, y'all? What's up, Kick? Good to see you, Kick. All right. Here we go. Welcome in, mein Bruder. All right, where were we? Where were we? Oh, during clinical trials. During clinical trials. Turn that back on. Record. They establish that data must be recorded accurately, completely, and verifiably, and that all data collection and analysis processes must be conducted in a transparent and auditable manner. This is crucial. This is crucial to ensure that conclusions derived from clinical trials are reliable and can be used to inform decisions about the safety. I gotta hit pretty high. About the safety and effectiveness of new treatments and medicines. The implementation of internal monitoring. The implementation of internal monitoring and auditing systems is a GCP requirement, ensuring that data and processes comply with established standards. Globally, I don't like that. What's up, dude? What's up? Globally, GCP guidelines are adopted by several regulatory authorities. Including the Food and Drug Administration, FDA, in the United States, and the European Medicines Agency, EMA, in the European Union. I hate saying that. European Union. In the European Union. I feel like I'm using the entirety of my mouth when I say that. Union. In the European Union. The adoption of these guidelines by different countries. The adoption of these guidelines by different countries and regions ensures a harmonized approach to conducting clinical trials. Facilitating international collaboration and global acceptance of the data generated. This harmonization is particularly important in a scenario where multi-international multinational, where multinational clinical trials have become commonplace, with data collected in several regions. It's getting too clunky. Hold up. With data collected in several regions. With data collected in several regions being used for applications for approval of new medicines and treatments in different markets. Yeah. The GCP also emphasizes the importance that everyone involved in conducting clinical trials, from investigators and sponsors. The GCP also emphasizes the importance that everyone involved in conducting clinical trials, from investigators and sponsors to monitors and auditors, has the necessary qualifications in training. Thank you. And training. Where was that? And training to perform their roles. Not ours. To perform their roles in accordance with the highest ethical and scientific standards. Standards. This includes ongoing training to stay up to date with regulatory changes and best practices in the field of clinical research. In the field of clinical research. All right. Big breath. Still one, so that's good. Still one. That's right. Still one. Wait. Won my first match? Dude, look at you. Thank you so much, Kirsten. Thank you for the heart me. Thank you for the heart me. Thank you for the finger hearts. Thank you for the finger hearts. Appreciate you. You are amazing. Thank you for all the wonderful love on TikTok. I appreciate you. For all you guys over on YouTube and Twitch, I'm also on TikTok at reader.rick. I'm broadcasting live tonight, but you don't get all of the cool interface. I will say that. All the cool interface you don't get on TikTok. So you just get the face. But it does get a lot of views over there, I will say. So far we are at 136 views. That's not bad. I'm pretty sure if I looked at my views on Twitch, like the impressions that I've got, let's see. If I went into my Gmail, oh, look at that. Dude, we got images from Radio Rick. That's funny. Oh, that's cool. All right, let's go Radio Rick. He's got cool images. This was in a class. Nice. I'll definitely have to connect with them. I don't know why my face looks so bloated in these, but whatever. Thanks, Richie. Thompson. You the man. What else? So I'm going on here and let's go on to my Twitch. I don't think it's on this account. And I don't want to log into another account. Okay, actually, here we go. So my last chill editing stream for 2 hours, it had 5 viewers. It had 5 viewers. So, how many impressions though? See full summary. Let's look at that. Let's see the full summary. Okay, so let's take for example my last stream, which was Sunday, April 27th. Discovery. I think that's a good indicator right here. So 17 views outside of Twitch. Thank you very much. I appreciate that. We get thousands of impressions on Emiru. Hassan. Thanks, Hassan. I appreciate you. Jay Schlatt. We got Ms. Kiff. You know, we got thousands of impressions on those. 12 from Emiru. So thank you. Shout out to Emiru's chat. Appreciate you. But let's see, this was my last one. Yeah, you can't really see how many people watched it. But I appreciate you guys. All I'm saying though, if you look at analytics, there we go, 64 unique viewers. Why can I see it here but only as a group? Anyway, in the month of April, I believe I've had 64 viewers. I've had 64 people tune in. And I've had almost twice that, actually more than twice that, in this one TikTok stream. So when we talk about like discoverability, there's so much more discoverability on TikTok. Like, it's insane how much is on there. Everyone follow Eric on all the socials: Insta, TikTok, YouTube, Twitch, Audible at Eric Pullman. Thank you so much. Kirsten, I appreciate the plugs. Thank you, Kirsten. But all I'm saying though is that TikTok is phenomenal for getting your content out to new people, to more people, to find an audience that you don't currently have. They do a really, really good job of that. So I love that. I really do love that. But at the same time, I feel like the interface of Twitch is so much more fun to interact with. Like, I can do so much more constructing my page, going onto YouTube. I can make YouTube videos that are associated with the live streams. Like, you can do so much more on the other platforms that I wish you could do on TikTok, but TikTok doesn't allow me to do certain things. Principally, like, broadcasting this to TikTok would probably be the next step, but I cannot do that because they don't have their studio for the Mac. It is just for Windows users. Weirdly enough, it's just for Windows users. Thanks, TikTok. But I'm sure they'll get there at some point. Rights of research participants. Research participants have fundamental rights that must be protected when conducting clinical studies. These rights include 1. Informed consent. Participants must be informed of all relevant aspects of the study, including the objectives, procedures, risks, potential benefits, and treatment alternatives. Informed consent must be obtained voluntarily without coercion and must be documented. 2. Privacy and confidentiality. Participants' personal right? I know, right? Participants' personal and medical data must be kept confidential, and protected against unauthorized disclosure. Participants' privacy must be respected during all phases of the research. 3. Damage protection. Researchers must take all necessary precautions to minimize risks and protect the safety of participants. Any adverse event must be monitored and treated appropriately. 4. Right of withdrawal. Participants have the right to withdraw. Participants have the right to withdraw from the study at any time without suffering any penalty or prejudice to the quality of health care they receive. Practical cases and examples of good practices. Case 1. Yeah. Case Case 1. Case 1. COVID-19 vaccine. Debatable. Joking. The research and development of COVID-19 vaccines represented a milestone in the history of medical science. With multinational clinical trials conducted over an unprecedented period of time. A particularly notable example is the Pfizer BioNTech vaccine clinical trial, which involved collaboration from several countries, including the United States, Germany, Turkey, South Africa, and Brazil. This study was emblematic in demonstrating the importance of international collaboration and strict adherence to ethical standards to ensure. I mean, take it back. I don't like that inflection. Blech. This study was emblematic in demonstrating the importance of international collaboration and strict adherence to ethical standards to ensure both vaccine safety and efficacy. Thank you so much for the rose and the ice cream, Ryan. I appreciate you. I appreciate you for the goat. Thank you for the goat. Thank you. Conducting the clinical trial of the Pfizer BioNTech vaccine involved the participation of tens of thousands of volunteers distributed across different continents, which allowed for a broad and diverse assessment of the vaccine's effects on different populations. This global reach was essential not only to guarantee the representativeness of the results, but also to accelerate the vaccine development but also to accelerate the vaccine development process. Given the emergency nature of the pandemic, the the geo the geographic diversity of clinical trials allowed participants to collect relevant data in different epidemiological in different epidemiological in different epidemiological, climatic, and demographic contexts. Increasing the validity and generalizability. Yeah, representative, right? All right. Increasing the validity and generalizability of results. Compliance with strict ethical standards was a central aspect in the conduct of these trials. I should write these words down and then practice them over and over and over again. These will be my tongue twisters. Generalizability. Right? Compliance with strict ethical standards was a central aspect in the conduct of these trials. From the beginning, it was ensured that participants were fully informed about the potential risks and benefits of the experimental vaccine, and that informed consent was obtained voluntarily and clearly. Thank you for the finger hearts, Ryan. Thank you so much for the finger hearts. I appreciate that. Research ethics committees in each participating country reviewed and approved study protocols, ensuring that rights and well-beings of volunteers were respected at all phases of the trial. Okay. Another critical factor in the success of vaccine development was the speed with which data was analyzed and communicated without compromising quality or safety. One number two, but not MVP. I'm a failure. Oh my gosh, you are absolutely not my brother. You are absolutely no. What I meant to say was you are my brother. You are not a failure, comma, my brother. That is what I meant. Don't clip that. Do not clip that. I did not say you were not. Anyway, I love you. Even if you're number two, you're number one in my heart. I love you, bro. Another critical factor in the success of vaccine development was the speed with which data was analyzed and communicated without compromising quality or safety. Transparency in communicating clinical trial results. Transparency in communicating clinical trial results was key to building public trust in to building public trust in the vaccine. Pfizer, BioNTech, and other companies involved maintained an open line of communication with regulatory authorities and the public, sharing preliminary and final data in a clear and accessible way. This transparency was essential. Blech. This transparency was essential to addressing vaccine hesitancy and ensuring rapid acceptance and global distribution of the vaccine. I might have to stop here soon because it's like raining pretty hard. And I don't know if that's translating to the mic. This is what I meant. Don't clip that. Do not clip that. One number 2, but not MVP. Even if you're number 2, you're number 1 in my heart. I love you, bro. This transparency was essential to addressing vaccine hesitancy and ensuring rapid acceptance and global distribution of the vaccine. Regulators such as the FDA in the United States and the EMA in the European Union adopted accelerated review procedures which allowed emergency approval. Which allowed emergency approval of the vaccine in record time without compromising the rigor of the analysis of safety and efficacy of data and efficacy. It's not written correctly. Hold up. I liked it the first way, but of safety and efficacy in data of safety and efficacy of the data. This COVID-19 vaccine. Let me take it back. This COVID-19 vaccine case illustrates how the combination of international collaboration, compliance with ethical standards, transparent communication, and regulatory agility can lead to the rapid and safe development. Gotta get my moisture out of my mouth. And safe development of medical interventions. Thank you for the rose. Thank you so much for the rose, Ryan. Where was I? And safe development of medical interventions in response to public health crises. The success of the Pfizer BioNTech clinical trial not only brought it's getting heavy, hold up. Not only brought a crucial solution to the pandemic, but also established a new paradigm for vaccine research and development in future global emergencies. Case 2, gene therapy. A clinical trial. A clinical study in France explored the innovative use of gene therapy to treat a rare form of hereditary blindness. Known as Leber congenital amaurosis. Known as Leber congenital amaurosis. Let's check the pronunciation. How'd Jay say? Leber. Congenital amaurosis. Okay. Let's Google it because it's not on How Jay Say. So let's Google it. And get a lot of stuff. How about Wikipedia? Where you at, Wiki? WIKI. I should donate to Wikipedia because I get so much info from that. Leber congenital amaurosis. And does not have a pronunciation. Ooh, here we go.
Leber congenital amaurosis.
Leber congenital amaurosis.
Leber congenital amaurosis.
Okay. All right. I think I disagree with this book. Well, bro, I wish you should submit that to Audible. You should say, Audible, this book is butt. It's ass. I cannot agree with it at all. There's nothing about it that I agree with. And the narrator sounds dorky. I don't like him. That would actually be kind of funny, to be honest. All right, let's see. Thank you so much for the roses, Ryan. I appreciate you. All right, let's see. Let's take two. Known as labor congenital. Known as labor congenital amaurosis. This condition, caused by mutations in specific genes responsible for retinal function, leads to progressive vision loss, often from childhood. The clinical trial in question involved injecting a modified viral vector directly into patients' retinas with the aim of correcting the genetic mutation underlying the disease. In this study, researchers used an adeno-associated viral vector. AAV, to carry a healthy copy of the mutated gene into patients' retinal cells. The choice of this vector was based on its proven ability to effectively and safely deliver genetic material into target cells without causing a significant adverse immune response. The procedure was performed with surgical precision. The procedure was performed with surgical precision, injecting the vector directly under the retina, allowing the corrected gene to be expressed in photoreceptor cells. Allowing the corrected gene to be expressed in photoreceptor cells, potentially restoring visual function. The conduct of this study was carefully aligned with the ethical guidelines established by the Declaration of Helsinki and good clinical practice standards and good clinical practice GCP standards. Before the trial began, I think I hit the mic there, sorry. Before the trial began, all ethical and scientific aspects were reviewed and approved by a research committee, ensuring that the rights and well-being of participants were protected. Informed consent was obtained from all participants or their legal guardians, with a clear explanation of the study objectives potential risks and benefits, and available treatment alternatives. Participants were closely monitored throughout the study, with ongoing assessments of the safety and effectiveness of the treatment. The results of the study were promising. Many of the patients treated showed significant improvements in visual acuity and light sensitivity, marking a notable advancement in the treatment of a condition previously considered intractable. These results not only demonstrated the effectiveness of gene therapy in the context of hereditary blindness, but also opened new perspectives for the treatment of other genetic eye diseases. Based on the positive results of this clinical trial, regulatory authorities such as the European Medicines Agency EMA, and the Food and Drug Administration, FDA, in the United States, quickly reviewed and approved the treatment, allowing it to be made available to patients in everyone. I don't know what that's supposed to mean. Allowing it to be made available to patients everywhere. This approval was a significant milestone. Highlighting gene therapy as a new frontier in precision medicine, capable of addressing genetic conditions at their molecular root. Gene therapy for Leber congenital amaurosis. Gene therapy for Leber congenital amaurosis not only brought hope to patients with this devastating form of blindness, but also represented a significant advance in the clinical application of gene therapy. This case highlights the importance of adhering to rigorous This case highlights the importance of adhering to rigorous ethical standards and exemplary clinical practices when conducting clinical trials, ensuring that promising innovations can be developed in a safe and responsible manner, resulting in tangible benefits for patients around the world. Okay, all right. I think we've been going for a minute, so I just want to take a breather. Usually I would take a drink, but right now I'm out. It's out. I'm gonna look. We have I think it's just case 3, and then it's chapter 5. So we're right there at the end. We have 1, 2, 3, 3.5 pages. So it's really close to the end. I'm just about there. I am just about there. So what time we at? We had 2 hours and 35 minutes, dude. That's way longer than I anticipated. I am so sorry, Austin Lacey. I'm going to have to deny your request to join. I appreciate you, though. All right. Okay. Case 3, malaria research in developing countries. An international research consortium.
Consortium or consortium.
Consortium. Okay. Consortium. That's how I said it. An international research consortium has conducted clinical trials to test a new malaria vaccine in several countries in sub-Saharan Africa, a region where malaria represents a leading cause of mortality, especially among children. This study was of particular importance. Due to the significant burden of the disease in the region and the vaccine's potential to save countless lives. However, the study faced considerable challenges, especially related to obtaining informed consent and obtaining informed consent in communities with low literacy levels, and protecting vulnerable populations. Nice. That was good. Obtaining informed consent was one of the main challenges, given that many participants and their families had little or no literacy, making it difficult to understand scientific concepts and study procedures. To overcome this obstacle, researchers developed educational materials adapted to local needs. Instead of relying exclusively on written forms, visual materials such as posters and videos were created that explained the objectives, risks, and benefits of the study in a clear and accessible way. Additionally, researchers organized researchers organized community information sessions where they personally explained study details in local languages and used culturally and used culturally relevant analogies to facilitate understanding. These sessions also allowed participants to ask questions and express concerns, ensuring that consent was truly informed and voluntary. The protection of vulnerable populations. The protection of vulnerable populations, another central concern, was addressed by implementing stringent measures. Stringent. The protection of vulnerable. The protection of vulnerable populations, another central concern, was addressed by implementing stringent measures to ensure the safety and well-being of participants. Given the context of poverty and limited access to quality health care, it was crucial that the study was conducted in a way that not only respected participants' rights, but also improved their overall health. Nice. To do this, researchers ensured that all participants had access to appropriate Bibble, we are like 10 minutes away from wrapping this up. We're like 10 minutes away from wrapping this up. We're like a singular page away. We're so close to ending it, and I gotta end this because we've been at it for about 2 hours. I gotta end this. It's too much. After you read, of course, Rick is here to read. But we'll be going live in the other account here soon. Not tonight, but at some point in the near future. Let's see, where was I? What was I saying? Had access to appropriate. Was it have access to appropriate health care? Where was I? I am done. We're almost there. Oh, here we go. To do this. Okay, we were on to do this. To do this, researchers ensured that all participants had access to appropriate medical treatments during the study, regardless of whether they received the experimental vaccine or a placebo. Additionally, robust monitoring Robust monitoring measures were established to quickly detect. Additionally, robust monitoring measures were established to quickly detect and respond to any oof. McRib? Yo, what's up, McRib? That's going in. It's going into the record. We got the McRib in here. What's up, David Lyons? Good to see you, David Lyons. We got the McRib showing up. We got the McRib. What up, dude? What up, David? What up, David? The editor's going to see this. The editor's me. I'm the editor. Regardless of whether they received the experimental vaccine or a placebo. Additionally, robust monitoring measures were established to quickly detect and respond to any adverse events that may arise during the trial. I like the one before. That may arise during the trial. Data confidentiality was also a priority, especially in communities where stigmatization of health conditions may be a concern. The researchers took precautions to ensure that participants' personal and medical information was stored securely, and that only authorized personnel had access to this data. Strict protocols were established for handling and protecting information. And participants were informed about how their data would be used and protected. The success of this clinical trial not only demonstrated the success of this clinical trial not only demonstrated the potential efficacy of the new malaria vaccine, but also highlighted the importance of good ethical practices and cultural adaptation when conducting research in international contexts. The researchers careful and culturally sensitive approach combined with strict adherence to ethical standards allowed the study to be conducted with respect for the participants and with results that were reliable. Need space between that. That were reliable and relevant to global public health. This case highlights the complexity of conducting clinical research This case highlights the complexity of conducting clinical research in developing countries. This case highlights the complexity of conducting clinical research in developing countries where cultural, economic, and logistical challenges can be substantial. However, that's probably. However, it also illustrates that with adequate preparation, cultural sensitivity, and ethical commitment, it is possible to conduct studies that not only contribute to scientific advancement, but also respect and protect the communities involved. The positive results of this study have strengthened international research collaboration and reinforced the importance of robust ethical practices in finding solutions to the world's most pressing health problems. So if I could do that last sentence one more time, because I want it to be compelling enough to like go to the next chapter. Oh my gosh, I have to not eat before I do this. The positive results of this study have strengthened international research collaboration and reinforced the importance of robust ethical practices in finding solutions to the world's most pressing health problems. All right. It might not be my best take. I don't know. I would look at all of those, to be honest. I would look at all of those last lines there because well, I'm not sure the last one was the best one, but you do you. You do you, boo. Love you. Talking to myself there. I'm going to see it. I'm going to see that. So we made it, guys. We made it. We're at chapter 5. We are at chapter 5. Now, the goal was to spend an hour recording. And here we are like 3 hours later. We have an hour and a half recorded. Can't stay awake. Have a great night. Thank you so much, Kirsten. Thank you for popping in. I appreciate you. I am about to sign off as well. So perfect timing. Good to see you. And thank you so much for tuning in. I super appreciate you. Thank you for all the wonderful gifts here on TikTok. You are amazing. Love you, but I can't keep my eyes open anymore. Good luck with the book and good night. Thank you, thank you, thank you. We're slowly chipping away at this one. I don't think that we're going to be done with this one anytime soon. We're at 133 pages of 320. Let's do a little math. That's 133 over 320, which is about, you know what? We're a good fraction through. We are a good fraction through. We are 41% of the way through. So that's not bad. It's not bad. I think once we cross over the halfway point, I'll feel like, oh, let's just knock this out. Like I feel like we're going to get there real soon. So really happy when we get to that point. But for right now, we're just slowly chipping away at it. And as you can see, you know, I wanted to go live for an hour. Here we are 3 hours later. And what do we get out of it? Out of that 3 hours, we got about an hour and a half of recorded content. So we're about at a 1 to 2 factor there. Let me turn my Evo 8 on. I'm going to duplicate for a second. So sorry about that. Then I'll turn this inner monitoring off. I'm going to mute that, duplicate this, make it up here into chapter 5 so I know where I'm at. I'm going to unmute it and then bring this back to the beginning. File, save. And in the meantime, in the background, I'm going to upload all of these. I'm going to export them probably tonight and then put them up on Descript. That will make things much easier if I can get these on Descript. If I can get these 4 chapters, that'll be cool. And then I don't know, maybe we'll edit these tomorrow and we'll put it up on the website. So we love to see it. Thank you so much for tuning in, guys. I got to double check on Kick. There's nobody on Kick. So if you pop in, good to see you. Love you. What else? We got McRib in the chat. Good to see you, McRib. Oh my gosh, I didn't even see that. Thank you so much for the goat. Thank you for the finger heart. You were amazing, Kirsten. Thank you for all of those wonderful gifts. I can click on you and I can see all the gifts that you sent. Thank you so much for all of these. We got the Heart Me, the Night Star, the Good Night, the this is Ryan. Okay, I was like, the other Heart Me. Hold up. Thank you so much for the roses, Ryan, the heart puffs, the lightning bolt, the goat, the Heart Me. Kirsten, thank you for the more finger hearts, the ice cream cones, the rose. Thank you for everything. You guys filled up the gift gallery tonight, so thank you so much for that. I really appreciate it. If there's one thing that I know that I have great people that watch me, so thank you so much, guys. I truly appreciate you. I truly appreciate all the love and support. Cannot thank you guys enough. You guys are fantastic, so thank you so much for that. And we're going to make good things. We're going to make good things out of this. We have... we got to chapter 5, so we're about 5 chapters in. Once we're done with this, we'll be about halfway into this project. I'm thinking we can knock this out pretty quickly, though. Not gonna lie, with the AI thing that we have now, Descript. Shout out to Descript. You are amazing. I really appreciate you and everything that you've done to make my progress infinitely easier. It makes my productions way better. It makes it way easier to get there. And even though we do a lot to editing still, it makes getting to that point way better. So thank you. Shout out to everybody on the team of Descript. I appreciate you. And that's it for tonight. So thank you so much for tuning in, guys. If you're watching this on the playback, I appreciate you. I see you on the playbacks of the lives. So thank you so much for that. And we're not going to stop. We're going to just keep pumping these out like crazy. And I'm going to get better. I'm going to improve the production quality. We're going to get a better recording studio space, something that's going to look a little bit more impressive than the closet. Love the closet. Love what it does. But we gotta make improvements, and I'm here to make relentlessly more improvements to improve the production quality and make this a better watch every single time you return. So that is my promise to you. And as we discussed in this chapter, I'm a man of my word, regardless of what that means. So we are going to relentlessly pursue improved production quality. Whether that means Neumann mics, whether that means sound isolation, whether that means recording studio, whether that means creating a whole production team. Who knows what that entails? But all I'm saying is that I'm here for that adventure. And I'm going to promise that it will be an adventure. So stay tuned. And we're going to make bigger and better projects as we go along. And I will keep you guys informed every step of the way. So thank you so much for tuning in. I appreciate you guys. And you